Hello, everyone. Sawadee Kap. Welcome to the sixth international conference with the theme Diversity, Equity, and Inclusion in Health, Sports, and Kinesiology, held in Chulalongkorn University, Bangkok, Thailand. I am Leonard John Varias Carillo, and I have here with me my collaborator, Mr. Oliver O. Gomez, and I am going to present to you my thesis entitled Enhancing Hip Joint Flexibility with Yoga and Proprioceptive Neuromuscular Facilitation, or PNF, a quasi-experimental study. I am from Valencia City, Bukidnon. I am currently working at Caraga State University, Cabadbaran City, Agusan del Norte. Now, if you want to contact me or if you have questions regarding my results or my study, you may contact me via lvcarillo@csucc.edu.ph using Gmail. Without further ado, let's start. Flexibility is very vital for everyone. It is vital for the overall health, and it involves the flexible joints, which support the body movements and balance. However, sedentary lifestyle, lack of stretching, and aging may reduce range of motion, or ROM, and the quality of life as we are living now. Limited ROM occurs when a joint or body part cannot move within its normal range of motion, and interventions are needed to address decreased flexibility and physical activity and tightness among participants, or is focused on the interventions which aims to improve the hip joint lateral range of motion, which is very crucial for student health or even participants, movement efficiency, and injury prevention. This research examined the effectiveness of interventions using PNF, or again, proprioceptive neuromuscular facilitation and yoga, to improve side splits, allowing physical educators to design home-based activities that can help minimize the risk of physical activities and a sedentary lifestyle. Now we have figure one, which is the schematic presentation of the interplay of variables. We have here our dependent variable, the hip joint flexibility, and our independent variable, which are PNF for group 1 and yoga for group 2. In group 1, we used standing hamstring stretch, seated hamstring stretch, and self-assisted single knee to chest. For group 2, we used mountain pose combined with child's pose, warrior pose combined with triangle pose, and forward fold combined with three-legged downward facing dog. Now, if you have questions how I did the pre-testing stage and the post-testing stage, and as well as the intervention stage, you may visit my YouTube account, Leonard John Varias Carillo, and you may search there the isosceles triangle test, which is the test that I use to check the flexibility of my participants. And I also have uploaded there an exercise for yoga and for PNF so that they can follow it while they are at home. And you may also follow it while you are at home. Statement of the problem for problem one: what was the male and female participants' lateral hip joint flexibility performance before and after the interventions? Number two, how did the two groups of male and two groups of female participants' lateral hip joint flexibility differ before and after the intervention? So we are talking about the pre-test and the post-test stage. And lastly, did the two groups of male and female's flexibility increments differ significantly? Now for the research methodology. For the research design, we used a quasi-experimental design. For the participants, we have 35 males and 45 females. For the research instrument, which was a researcher and an advisor-made test, we used the isosceles triangle test, which went to using Lao Tzu table to check its validity. And for the reliability of the research instrument, we use the test retest method. Now for the findings. For problem number one, let us note that we separated the female and the male. For females, in the initial lateral hip joint flexibility or the pretest, PNF group was fair, while the yoga group was poor. However, after the interventions, Both groups showed significant improvement in lateral hip joint flexibility, which is outstanding, which indicates the successful effectiveness of the interventions in enhancing range of motion scores. Now, if you are wondering where did fair, poor, and outstanding came from, we used this in our scoring procedure. We have outstanding, very good, good, fair, and poor description. What we did is we converted the raw score to the total score and then classify the scores under the following norms, which are poor, fair, good, very good, and outstanding. For males, both PNF group and yoga group showed poor initial lateral hip joint flexibility or the pretest. However, after the interventions, the PNF group has improved to outstanding, while yoga is only fair. Let's proceed to problem 2. On the one hand, there is a significant difference with large effect size because we use Cohen's d effect size between the pre-test and the post-test flexibility measures of the PNF and yoga group for females alone, which indicates that both exercises are very effective interventions in enhancing hip joint flexibility. On the other hand, there is a significant difference between the pre-test and the post-test flexibility measure of the male PNF group only. In contrast, there is no significant difference for the male yoga group. So this indicated that the PNF exercise is more effective when it comes to their scores. For number 3, the increments of the two interventions do not significantly differ for females, which indicates that both interventions are comparably effective. On the contrary, the increments of the two interventions significantly differ for males. This indicates that the PNF exercise is more effective in enhancing hip joint flexibility than the yoga exercise. Now for the conclusion, the study successfully accomplished its goal of assisting physical educators in designing comparable home-based activities through effective interventions, namely PNF and yoga. The study confirmed that both interventions, PNF and yoga, effectively improved participants' hip joint flexibility and range of motion using the quasi-experimental research. And this is the most important thing. When we consider doing an experiment, we should always think of the proper design or the research design to use. In this case, we used quasi-experimental design. As for the recommendation, for the future researchers, you may explore hip joint range of motion and flexibility in individuals with school-based interventions, meaning you may modify the exercises or you may use different exercises using the same research design. Number 2, the researchers or future researchers may test sex differences to assess intervention effectiveness. In my thesis, we have only shown the results for male and female, but we did not assess if the intervention's effectiveness was different for both sexes. And lastly, please consider modifying intervention intensity, repetition, and duration based on flexibility level and overall fitness. That would be all. Thank you so much for listening. And again, you may contact me via lvcarillo@csucc.edu.ph if you do have further questions regarding my study. Thank you so much for this opportunity, and I am hoping to see more of these conferences. Sawadee krap.